Hi guys, welcome to our abdomen anatomy lecture. Today we're going to talk about the esophagus, the lower abdominal esophagus. So the esophagus is divided into three. There is a part, the upper two-thirds or the greater part is going to be found right inside your thorax, right? And then a small part is going to be found in your abdomen. So today we're going to focus on the abdominal esophagus. We spoke of the thoracic esophagus in our thorax anatomy lecture. So today let's take a look at the abdominal esophagus. So the abdominal esophagus is not long, it's a short, about 1.25 centimeters. That will be between the esophageal hiatus at the level of T10 and piercing the cardiac orifice or the stomach. Remember the esophagus, it connects the pharynx and the stomach, right? And it is a muscular tube, right? And then in cross section histologically, we can actually understand that the lumen of esophagus is star-shaped because of those folds. Remember, yes, we have the mucosal folds due to the muscularis mucosa. You understand? So right here, this is your abdominal esophagus. It's about 1.3, 1.25 to be more specific, centimeters long. The wall of the esophagus is about 25 centimeters long. And if you remember very well from our thorax anatomy, we said that the esophagus is actually um, constricted in three regions, right? The first region is going to be the region at your pharyngeal esophageal junction, right? That's the first, and then that's where we have our upper esophageal sphincter, and then our second is gonna be your bronchoaortic constriction, which is when the esophagus is gonna be crossed by the arc of the aorta and the left main bronchus of your what of your trachea. And then the last constriction is your diaphragmatic constriction, right? If the esophageal pierces the diaphragm, is going to be surrounded by the right crus at the at a finger breadth from the midline, if you remember very well. Good. So the esophagus in the abdomen is very important in terms of its um, um, clinical correlates that we are going to talk about, which we call esophageal varus. They are very important, right? So the esophagus pierces the diaphragm at the level of T10, and if you remember, the diaphragm was um, was going to have a superior and inferior diaphragmatic fascia, if you remember very well. And these diaphragmatic fascia, they actually condense and attaches to the esophagus, forming what we call phrenico esophageal ligaments. These are very important because they actually stabilize the esophagus via the process of peristalsis. You understand now? So this is your inferior or the lower limb of the phrenicoesophageal ligament, and this is your upper limb of your phrenicoesophageal ligament, which is actually very important. So we actually have what you call a lower esophageal sphincter, and a lower esophageal sphincter, it's a physiological sphincter. The upper esophageal sphincter is also a physiological sphincter. So take note, it's not anatomical sphincter. It has two physiological sphincters. And the lower esophageal sphincter is actually going to be made by the right crus of the diaphragm, the musculature of the right crus of the diaphragm. You understand? So there's a junction. If you are going to look at the histology, there's a junction that is between the esophagus and the stomach, as the esophagus drains itself into the cardiac orifice, right, anterior to T11 vertebrae. You're going to have what called an esophagogastric junction, which is called a Z line. This is actually visible when you're doing endoscopy, when you're actually seeing the lumen of the esophagus, the Z line. It is a Z line because it is a layer or an area of transition between your simple, your stratified non-keratinized squamous epithelia that is found in your esophagus, where it will be transitioning to be your simple columnar epithelia in the stomach. So it's actually an important site. You understand now? Good. So let's take a look at some blood supply, nerve supply, as blood supply, innervation, and venous drainage of the esophagus, especially focusing on the abdominal esophagus. Right. So let's take a look. Right, so let's take a look at the blood supply of the esophagus. So this is your abdominal esophagus as it enters the cardiac orifice, right? So the abdominal esophagus, it receives its blood supply via a branch coming from the left gastric artery. So you're going to have what called a celiac trunk, which is given at the level of T12, and the celiac trunk, one of its branches is going to be your left gastric artery. So you can actually see this left gastric artery, which supplies also the left cavity of the stomach, but it gives a branch which is called an esophageal artery that supplies the abdominal esophagus. Together, we also have another branch which we'll talk about later, that is called the a left inferior phrenic artery. So the left inferior phrenic artery plus the esophageal arteries coming from the left gastric artery supplies blood to the abdominal esophagus. Right. So let's take a look at the venous drainage. The venous drainage of the esophagus is very important because it actually gives understanding upon of understanding behind esophageal varices. You understand? So it's actually unique. Um, you have what called submucosal veins that are found in the submucosal of the esophagus, and these they are involved in the portosystemic anastomosis. So you have a part of the submucosal veins draining into the left gastric veins, and the left gastric veins will drain into the portal vein. And then you have other veins within the submucosa that will drain in the esophageal veins, and then these esophageal veins will drain into the esophagus vein system. So this communication is very important when it comes to esophageal varices, as we're going to see. What about the lymph drainage? So the abdominal esophagus will drain into the lymph nodes around the left gastric artery, and there's a lymph nodes. These are the gastric lymph nodes, right? They will later drain into the celiac lymph nodes. So that's the lymphatic drainage. Let's take a look at the nervous or at the innervation of the abdominal esophagus. Right. So the esophagus, abdominal esophagus, is going to be supplied by the right and left vagae, right? So we have what you call an esophageal plexus, right? It will be receiving sympathetic innervation as well as parasympathetic innervation. The parasympathetic innervation will be coming from the left and right vagal trunks, not nerves. So what happens is that in the abdominal esophagus, you have vagal trunks, not vagal nerves. So you have now have an anterior vagal trunk and a posterior vagal trunk, right? And it is why is it called an anterior vagal trunk, not a vagal nerve? So what happens is this, right? Remember that you have the left vagus nerve. So in the abdominal esophagus, the left vagus nerve will receive branches from the right vagus nerve and form an anterior vagal trunk. So the anterior vagal trunk is main branches coming from the left vagal nerve. And then you're going to have a right vagus nerve, which will receive some branches from the left vagus nerve and from the posterior vagal trunk. And it is the posterior vagal trunk that has the main branches coming from the right vagus nerve. You understand now? Good. So that's the innervation of the what? Um, of the abdominal esophagus. So let's take a look at some clinical correlates of the esophagus. Right, so this is what you call esophageal varices. How does it happen? Right, so I want you to get this now. Remember, you have your liver, and the liver, we have veins, the portal vein draining into the liver. and then from the liver it goes into the inferior vena cava. So in the patient where there's a liver cirrhosis, you're going to have fibrosis of the liver, and that will lead to blockage of some branches of the portal vein within the liver. So this will lead to what we call portal hypertension. So when there is portal hypertension, since we say that the esophageal veins of the abdominal esophagus will also drain into the left gastric vein, and the left gastric vein, the portal vein, and we have some veins in the esophagus that will drain in the esophagus veins. Right, so remember the esophagus vein will drain in the superior vena cava, remember? Good. So you're going to have a reverse of blood. Instead of going into the inferior vena cava, the blood in the portal vein will go into the left, will drain into the left gastric vein and drains into the esophageal veins. So the esophageal veins, they are not used to this kind of pressure, so they are going to dilate. So if you're going to look in esophagoscopy, where you're going to put an endoscopy and actually see the lumen esophagus, you're going to see some bulges of veins. So this is what you call esophageal varicoces. You can also see these varicoces. And if it is in extreme, they can actually uh, burst and lead to esophageal hemorrhage, which is actually a dangerous and a life-threatening condition. You understand now? So esophageal varicoces, they so that's why I say the abdominal esophagus is an important site for portal systemic anastomosis, because we have some veins draining into the portal vein and some veins draining into the esophagus vein. So thank you so much, guys, for listening. Take care and see you next time.